starting a study in the systematic review, randomized cultural study like this. So you should have a clear question, as Dr. Nekufar, if you remember in the previous session, explained about it, and also Professor Khami. And today, this topic, defining a clear question in evidence-based dentistry, will be discussed. Now, I would like to introduce today's lecturer, our guest speaker, Professor Sadiq Khan from University of Western Cape, Cape Town, South Africa. I would like to welcome to her. Before listening to the speech of our guest lecturer, I would like to present a short biography of Professor Khan. She is associate professor and senior lecturer in restorative dentistry in University of Western Cape in South Africa. She got her bachelor degree in dentistry in 1990 and got her master degree in restorative dentistry in 2007. She had a fabulous research on minimizing mechanical prosthodontic intervention for adult populations with shortened dental arch in South Africa, and got her PhD degree in 2017. And now she is the president of South African Division of International Association of Dental Research. She has had a long list of valuable research studies and publications related to restorative dentistry and dental educational research. She has had several presentations in international conferences. Now we have the chance to have one of her presentation in for today's session. We'll be running a live question and answer at the end of session for about 15 minutes. You can write a question in the chat box during the workshop, and your question will be answered at the end of today's sessions. And Professor Khami, if you have any explanation about today's session, please present about it. Professor Khami?
Hello, can you hear me?
Yes.
Okay. I would like to also say hello and welcome to all of the participants. Thank you for starting the second session of our virtual evidence-based dentistry course. And I want to especially thank and welcome Professor Khan, who kindly accepted our invitation, and now we are so lucky to have her here and can use her experience in the field of research and evidence-based dentistry. I'm sure that all of the participants would learn many things today. Okay, I don't want to take time more.
Thank you. Professor Khan, the stage is yours, please.
Thank you. Thank you for such a beautiful introduction. I'm humbled by your kind words. Thank you for the opportunity, and thank you for those attending. Without them, there wouldn't be a workshop. Anyway, I hope my presentation is going to add value, of course. Yes, I have done a bit of evidence-based healthcare. I've extended myself in that way. And I'll speak a little bit about that because I've actually now included it for the last 3 years in our undergrad dentistry program at my university. I also teach it to postgrads, and of course I teach it to staff. So evidence-based healthcare and the principles thereof is very close to my heart. I will start my presentation. I think I'm going to stop the video, but I'll keep the of course, the sound, just so that we don't have any other interferences. But let me first share my screen with you, and we'll take it from there. I hope, just let me know, Fariba, if you can see my screen.
Yes, we can see, Professor Khan.
You want me to make it onto the... You want me to make it on the full slideshow?
No, it's not a full slideshow. Please change it to full slideshow.
I'm trying to, yes. Okay, there we go. I just wanted to change the video, so let me just go back to video and take where we are. Where are we now? Just stop the share for a moment, and I'm going to just switch the video off and then share with you. Thank you again, everybody. I see the program was quite specific as to what you wanted from me. And just from your introduction, I heard that you have spoken quite a bit about the principles of evidence-based healthcare. So forgive me if there's a bit of overlap. Before I start, let me tell you where I come from. This is my university. This is our big section of the university where our major university, but of course we are not based here. We're based at a hospital. And as you can see, we are 60 years old this year. So we're not that old, the university. But unfortunately, due to the pandemic, we've not had a real celebration of the 60 years. We are based in South Africa. This is a beautiful picture of Cape Town. Cape Town has everything: warm waters, cold waters, beautiful mountains, forests, whatever you want, you can have and find in Cape Town. We're based at the tip of Africa. That's where the two oceans come together, so we can show you that as well. So that's our beautiful Cape Town. Just a little bit about where we are. In the University of the Western Cape is actually based in 3 of the major hospitals in Cape Town. Firstly, at Tygerberg Hospital, which is a large hospital, so we have a little section, and that is our base. That's where we are. Groote Schuur Hospital, if you've ever heard anything about Cape Town, where the first heart transplant was conducted, and successfully so. Dentistry has a clinic right here in the outpatient section. Then we have the largest children's hospital in South Africa, or in Africa actually. So we see patients from all over Africa that come here, children, that is. And dentistry has a clinic there as well. And then, of course, our faculty is split between 2 places, Tygerberg Hospital and the Mitchells Plain Medical Center. So we teach across those faculties. Plus, we have several other satellite clinics that we work in. So that's just a little bit of where I come from. I'm in the Department of Restorative Dentistry, but research is my passion, so I go across disciplines. So evidence-based healthcare, I've latched onto the medical faculty based next door by us, and I've learned lots of evidence-based healthcare and everything related to that. So I'd like to share that with you. So I am a lecturer, so this is where the whole structure of what I'm going to present to you comes from. I think my directive was to talk about the types of clinical questions that you get, how to develop these questions, the framework or frameworks for these specific questions, and steps to guide you to develop these questions. And of course, we'll do some examples as well. And as I said, I'm a lecturer, so I'm going to give you an exercise right from the start. While I'm busy with the presentation, I would like all of you that are busy, that are in the session, to create your own clinical question. Think about anything that you need answers for. So that's the exercise for now. And we'll speak a little bit more about that later on. Challenges, of course, I've listened to you. Firstly, there's going to be an overlap with what someone else has done, or maybe what someone else is still going to do. There's a challenge in terms of the diversity of the group of students. I got the latest update of your students, and maybe I'm lucky they're not all here, 369 of you, but there's a number of you and you come from different backgrounds. And so the challenge is the diversity of the group. I have no idea your level of understanding, your level of experience, whether you are novices or not. So please forgive me. I've tried to locate my presentation just following the basic principles. And so if it sounds a little bit too basic, just look past that and see what else you can take from the presentation. I'm also we speak about clinical questions and we speak about research questions, but we use those terms a little bit interchangeably. So that could be a challenge for people as well in their understanding, but I'll try and sort of separate the two and make it a little easier for you. And of course, being online is a great challenge. in terms of our communication with one another. You know, when we used to a workshop, you have a notice board and you have pens and pencils and you write and you have interaction on that level. So of course we don't have that. But do feel free to question and ask in the chats, WhatsApp. I will leave my email address with people as well at the end of the session. So I hope this will be of some guide and we'll take things ahead from here. Just to start and locate where we are and why we speak about clinical questions and research questions and the evidence related to it. You know, why is this so important for all of us? Firstly, and I think the most important thing is we want to improve our quality of care to our patients. We want to decrease the risk of adverse events that patients may experience with whatever treatments we advise them on. We need to decrease the risks to patients, improve not just the quality of care to patients, but also the quantity of care to patients. We want to also improve patients' quality of life. So whatever we're going to do is going to be based on those research questions and evidence that we obtain from it. It has been observed anecdotally and even with research that health systems do not use quality evidence optimally or as they should or as we expect them to use it. There are times when evidence is not used at all. So this causes inefficiency and a reduction in quality of life. Yes, we do get involved in continuous professional development programs to update our own knowledge by referring to evidence. But does this allow a change in clinical practices? Are we really taking that challenge on? So the goal of developing these research questions, we have different roles, you know, we have different responsibilities. So we sort of we sort of wear different kinds of hats. So, you know, the goal of developing these research questions and where these take you is responsibility of clinicians and academics. But more importantly, it is also the patient's rights to receive the best treatment. So we must provide them with that. And if you're an academic and based in the education sector where I am, curriculum reviews annually are very important. So we need to include evidence when we do that as well. We also need to reflect on our current practices, but also on our current teachings. Are we using evidence-based teachings when we do when we teach across the disciplines? Also, most importantly, when you're in the education sector, we are researchers. We hope everybody is a researcher in the academic because that is what improves our positions in the academic space. So we are researchers. So we need to find, and that's the goal for research. But more importantly, we speak to practitioners as well. When we speak about clinical research and clinical questions, that's where those clinical questions come from practitioners in the public sector. And we speak about reading smartly, and I'll refer to that a little later. Of course, the most important part is clinical practices and how we change clinical practices using quality research or evidence. And this is the most difficult part. And this is where the gap is. We need to change our practices in line with the evidence that's available. So let's get down to the task of the day, which is talk about evidence-based healthcare and evidence-based dentistry. And as I said to you, I'm sure you've had this definition before, but let me just run through it with you. Evidence-based dentistry is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients related to their oral or dental health. And this is why we are so set on changing and on evidence. While saying that to you, I'm also very, very cognizant of the fact that evidence is necessary, but it's not sufficient. It's not everything. We need other factors as well. We need practitioners' expertise. We need to know about the resource constraints. We need to know about patients and their preferences. We need to know about ethical considerations, plus the evidence. So there are lots of other aspects as well. So let's get down to the 5 steps of evidence-based healthcare. And as you must have seen this before, I'm sure it was introduced to you. The first step in evidence-based healthcare is posing an answerable clinical question. The second step would be to find the best evidence, and that's where your searching skills will be required. Thirdly is to appraise and critically evaluate the evidence. based on the evidence on validity, on the clinical outcome and the clinical importance. Lastly is to implement that evidence, and not lastly, second from last, and lastly is to evaluate whether a change in practice or that new method has improved healthcare. So we call it the 5 A's of evidence-based healthcare, the 5 principles. And my focus, of course, is only going to be on the first principle, and that's asking a well-formulated clinical question. The rest of the steps, we leave that to someone else. I see critical appraisal is on your schedule, so we wish well for the person who's going to do that. Why do we ask questions? We ask questions because you can't have an answer without a question. Sorry, I'm just going to move your little things away here. Some questions are self-evident, but others are not. Asking questions helps clarify a problem. Asking questions helps determine the course of action. And that's why we ask questions. So you must also always admit that you don't know something and then seek out the answers for that. So asking questions is key, and it allows you to select the best resource to answer your question or your query. The need for an evidence-based healthcare approach is very important. You cannot overemphasize this because it allows identification of uncertainty or the need for information, up-to-date, reliable, valid information. It's also important because it allows you to improve your knowledge base. And more importantly, it allows you to improve your skills, your clinical practices, but also your educational knowledge that you share with students. So you've got to have clinical format, clinical question. And when I speak about your skills, I speak about formulating clinical questions, your search skills, your appraisal skills, etc. Also, it allows you to improve your research skills. What do you understand by the different research skills? But most importantly, it allows you to change your clinical practices and improve care to your patients. So there are different types of clinical questions. Let's start with the first one. The first aspect that I had to look at was the types of clinical questions. And I'm going to take you through a series of these. The first, just to put them into 2 broad categories, the first type of clinical question is what is called the background clinical question. It's more about asking for general knowledge of a disorder or condition or test or treatment. It's what one would call the textbook information of anything. For example, what are the clinical manifestations of menopause? I'm not only going dental, by the way. I want to show you that we can cross boundaries here as well. Evidence-based healthcare is such a topic. What are the causes of migraines? These are all textbook information. Second type of question that you do get is what is referred to as your foreground question. Here you can ask specific questions, and the questions are very specific, related to knowledge about management of patients with a condition or a disorder. It's also a specific knowledge related to inform clinical decision making. The questions, the foreground type of question is concerns about a specific patient or population. It investigates comparisons, and it is more complex than your background question. And this kind of information, this kind of question, the information that you get here, the questions that you get is from your clinical space, but the answers to many of these would be in your journal articles. It's related to the evidence and to the research that's been conducted. For example, in a patient with osteoarthritis of the hip, is water therapy more effective than land-based exercise in restoring the range of motions of a patient? So you can see the type of question that we ask. It's a lot more in-depth, more complex than, of course, your background question. Background questions, like I said, dental school, basic knowledge kind of questions. Professional practice, your foreground question focuses on professional practice, your clinical practice. It's advanced knowledge, it's evidence-based, and it's very specific. So the clinical work, that's where we get the kinds of questions from. And it's when we treat patients, that's when the questions come up, and they relate mostly to cause and to treatments, and also to how to manage patients for different kind of settings. For example, clinical findings type of questions, etiology, questions that focus on differential diagnosis, questions that focus on different types of diagnostic tests, questions that focus on prognosis, questions that focus on different therapies, preventions, and self-improvement. These are just broad categories. I will go through most of these types of questions just to give you a little bit more an idea of what we're asking here. Let's start with the therapy kind of questions. It questions about the effectiveness of interventions improving outcomes in patients suffering from particular conditions. These are your most frequently asked questions. It would sort of cover questions like procedures, treatments offered by clinicians, medications, etc. Prevention type of questions. These are focused on the effectiveness of an intervention or exposure. Your diagnosis, the ability of a test or procedure to differentiate between those with or without a condition. Your prognosis questions. These questions are about the probable prospect of a patient's disease or the likelihood that he or she will develop an illness. Then you have etiology questions about the harmful effect of an intervention or exposure. And then, of course, your meaning type of questions about patients' experiences and concerns. Just to go through again, therapy questions. Does the treatment do more harm than good, or do more good than harm? And is it worth the effort and the cost? Then you have your diagnostic kind of questions. Which diagnostic test is more accurate in confirming or excluding a diagnosis based on certain calculations? Then your diagnostic questions usually compare the accuracy of tests. Then you have your prognosis questions. How do we estimate the patient's likely course over time and anticipate likely complications of disease? Then we have your etiology questions or the harm questions. What causes a healthcare problem or makes it more likely? For example, do tanning beds increase the risk of melanoma? Then you have another example would be, does obesity lead to increased risk of cardiovascular disease? Then you have your prevention questions. How can we reduce the chance of disease? What interventions have proven effective in modifying risk factors? Qualitative or the meaning type of questions would be, how is the person experiencing what is happening to them? What are their perceptions, their attitudes, or their beliefs? So these are just broad categories of questions. I think it's very important to know at this stage, recognizing your clinical questions domain is an important part of evidence-based practice. So establishing the question types allows you to identify the research methodology. Oopsie. I just needed to, yeah. It allows you to identify the research methodology that provides the best evidence to answer the question. Establishing a question, you also need to note the hierarchy of evidence that will differ according to the question type. And I saw in your schedule that somebody will speak about the hierarchy of evidence. Establishing the question type also allows you to select the best evidence-based practice tools to search for evidence. For example, the different databases. How do you know which database is going to work for you? And there are different databases, and some of them are very specific. So you need to know about those as well. Then, of course, establishing the question also allows you to select evidence filters in narrowing your search, giving you the most appropriate research methods. Identifying your question type will also assist you in critically appraising the evidence. Let's just focus a little bit on the different designs for the different types of questions. For example, when you're going to do a study on therapy and the therapy question, you probably would be most probably get answers by looking at randomized controlled trials. In a prevention question, again, of course, randomized trials, but also prospective studies. If you're looking at etiology question, you might have to look at cohort studies that will give you the best answer. And a meaning, the type of study would be related to meaning, you will have to look at qualitative research. And of course, this is the quality evidence or the hierarchy of evidence. And this is what my My colleagues always tell me it's my favorite triangle. And so I like to work from the top end of this triangle. And so most of the research, or the best evidence, of course, comes from the top end of that triangle. Clinical questions, I think we've referred to this earlier on when I said, where do we obtain these from? Clinical questions are usually complex, they are multifaceted, and they arise frequently in the course of our daily practice or work, or even in our teachings. So finding answers to these questions can be very problematic if you're in practice. So if you're not an academic, maybe it's a little more daunting for you to do that. Because of clinical practice time pressures, you might not have the time to go and search for the answers, or to develop questions. There might be a lack of awareness of high quality resources for finding research evidence, or the perceived or real lack of skills to formulate appropriate clinical questions, or the lack of searching skills. I mean, these are skills, even if you're in the academics, you sometimes struggle with them, especially if you're not a technology person. But most importantly, the sheer size of the clinical research literature available is enough to make anyone wants to run away from looking at evidence. I mean, I'm not even going to go through all the publications per day. Thousands of articles are published per day, and it's very difficult to keep up with the reading of that. And so there is an efficient method for tackling clinical questions, and I will focus on that a little later for you. But let me start with a clinical example for you, just to focus you as to where and how we get these clinical questions from. For example, a patient comes to you and she brings a 17-year-old daughter, and she says to you, "Doctor, my 17-year-old daughter is going to college next year, and I'm worried about the relapse because she has just completed her orthodontic treatment, relapse due to her wisdom teeth." So she says to you, "Doctor, what do you think? She's never had problems with her wisdom teeth, but should she have her wisdom teeth taken out before she leaves to college? I've heard that they can cause teeth to crowd, and she just got her braces off." So this is typically the kinds of questions that you can be faced with. And these are not the answers we might always have on our fingertips. Okay, so the approach here, or the response, could be one: have them out, I will refer you to a max-fac surgeon, or I don't know, I will refer you to a max-fac surgeon. Don't have them out, it's not needed. And if I just focus on the first three, it's literally shifting the responsibility onto someone else, not answering without having any evidence. But if you take another approach and you say, "I don't know, I will find out for you and advise you." If you look at the first two, you can answer the patient will be comfortable with your responses, but you yourself as an individual will not have the answer to that particular clinical question that was posed to you. The patient leaves your practice, and you set up a cycle of referring every patient based on your lack of understanding of the best ways to manage this type of case. But if you respond according to number 4, that is what we would call adopting an evidence-based healthcare approach. I don't know, I will find out, and I will advise you. Whichever way you find out. But at least you will then upskill yourself in terms of answering that question. So let's come to finding an efficient or method for tackling clinical questions. Firstly, one of the methods would be to convert that question into a manageable, answerable format using PICO, PICOS, or its variants. And there are different variants. So this is a format that evidence-based healthcare proponents have advised and have used over the years. You need to rephrase that question simply based on this mnemonic that you've developed, or that is available. And you can develop what is called a logic grid using the core concepts of the question. Lastly, you need to explore different synonyms and acronyms for each core concept in preparation for constructing an efficient and effective search strategy. So this is one way of tackling clinical questions. Now, there are different types of research questions. there are different types of questions. We speak very loosely. I said to you at the beginning, we speak about clinical questions and we speak about research questions. And I think it probably depends on where you're based. If you're a practitioner and you're more clinical, you're going to have those clinical questions and you need to then develop them. But if you're a researcher like I am, developing research questions is what we speak about. And so in research, once you've identified a broad area of your topic you want to research, you will then phrase that area into a research question. And there are 3 different categories for that. The first step would be developing a descriptive research question. And a descriptive research question would answer questions like who, what, where, and when. And the kinds of studies you would do here would be your prevalence studies or your incidence studies or even just case studies. The second type of research question that you do get is a question of relationships. How phenomena are related. For example, studies that determine association between low caries and fluoride in the water. So you want to establish that. You want to determine that. Studies, for example, that determine whether complex fillings are more likely to fail than simple ones. That's another example of questions of relationships. These kinds of research questions provide useful information when planning for practices. The third type of research question that you get is that of comparisons. Comparing 2 things to determine the cause and effect. And of course, here classically, you would have your RCT as an example of a research design. So I hope I've clarified at least the differences between where you get your clinical questions and where you get your research questions. Research is also always towards a degree, although not all the time. We do research all the time, and it's not always towards a degree, but it can be towards a degree. Just the goals of these different types of research questions. For example, your clinical questions mostly come from your patients. So it's for your own development at the same time. It's to upskill yourself, to improve your own knowledge. It also answers questions related to your patients and their queries. And of course, most importantly, it can change your clinical practices. So this will focus mostly on the first 2 steps of evidence-based healthcare approach, the first 2 A's. Research questions, however, you can actually do full-blown research with it. It adds to the body of knowledge. You can publish it. Of course, it can change clinical practices. And what's important here is you focus on all the 5 steps of evidence-based healthcare. And that's what's important. So that's the difference between the 2. I think we've come to the end of our first part. And I don't know if you want to sort of take a bit of a break at this stage, Dr. Fariba, because we said 15 minutes. I think my lectures are not that long because, you know, you don't want to overburden people with knowledge.
Yes.
We're still going to carry on with, you know, the format of it, etc. That was literally the introduction to it. So I don't know if you want to take your break now or should I carry on?
Of course, you have time to continue for presentation, but as you recommend, it might be it's better to have a break time for audience before continuing presentations. Professor Khami, what is your recommendations? That Professor Khan continue or have a short break for the audience? Professor Khami?
Somebody said maybe some questions. Of course, we may ask some questions. I think that should be
Dear
quite in
audience,
order.
yes.
I think also,
If
I think at this stage also, carry on, you carry on.
If anybody has questions up to now, you can ask the questions right in the chat box or ask the question from Professor Khan. Can we continue?
Someone said, can we continue?
Yeah, Kumar asked about it or questions. In these 15 minutes, it's the decision of audience. What is their preference? Please continue. So what did you mean by self-evidence questions? So it's better have different idea. I do not know what, Professor Khami, would you please recommend us what to do? Because the different audience has different idea about these 15 minutes.
What you can do at this stage, Dr. Fariba, is share the worksheets with them as well. Maybe you can share those worksheets I sent you.
Okay, can we share it now, Professor Khan?
Yep, you can. Yes, you may.
I will ask the admin to share the worksheet that Professor Khan shared with us, and I send it to you. May I ask the admin to share the worksheets that I sent to you now?
There's a question. It says, what's the difference between the question and the hypothesis?
Yeah. Would you please answer him?
We can answer. I hope I'm able to answer. Anyone can answer, actually, because we don't have all the answers. But I think a research question will focus your research. It tells you exactly what your entire research is going to be about and what it is, where you're going to find the answer. I think when you speak about a hypothesis, for example, if you do a test, you get two different kinds of hypotheses. And of course, most in research, as we speak about a null hypothesis, you're trying to prove something. So it might, it's more sort of direct at your research methodology. Are you going to prove something? A lot of people believe that a research question would be similar to your aim even of your research, but yet it is a lot more focused than just the aim. An aim can be very broad, but a research question is more focused. It is very specific. So yes, I actually meant you can share it with the I don't know if I answered your question. The hypothesis is something which you have to prove, and then you have to say whether you have proven it with your results in the end. Okay, I see now you said you can download the worksheets. Yes, of course, that's what I wanted to say. They can download
Excuse me,
the
Professor
worksheets.
Khan. Hello.
Yes.
The link of these two documents are already shared through the chat box, so the audience can download the file and can have the file to
Thank
fill
you.
it.
Thank you. I see that. Yes.
Dear audience, you can share the link and you can find the worksheet that Professor Khan kindly shared with us.
And remember the question that you must think of.
Yes, the questions should be answered according to the lecture that Professor Khan has about it. And you have any question, you can ask about these questions in the worksheet later. Is it fine, Professor Khan?
Yeah, we can speak about it later.
Okay.
I'm not so sure with what they mean. Yes, someone has asked, Mahsa has asked,
Yeah.
what did you mean by self-evidence question? I don't recall saying self-evidence question. Maybe they can just clarify what it is that they want to know.
Yes, somebody asked about, can we have a short break? Yes, you can.
Okay, sure.
Okay, now the time is 2 p.m. 41 minutes, so about 15 minutes later we come back again.
Okay, good.
5 to 3 p.m. or 5 to 15 minutes later we come back. It depends on the time according to different area that different countries that audience are. So in 15 minutes we come back again, and please, in this short break, look at the worksheet that Professor Khan kindly shared with us and answer the question. And when you come back, if you have any question about this short worksheet, you can ask from Professor Khan. Okay, go to a short break. Have a nice time. See you in 15 minutes later. Professor Khan, I say goodbye to you now. Just for 15 minutes. I'll come back to you soon. Okay?
I'm quite fine. I'm just answering someone's question in the chat.